This is Lab 11 on the dog specimen. Today you'll be looking inside the chest at the lungs and a few of the great vessels and things coming off of there. Okay, so when you have your chest opened, you'll be looking at the lungs and taking them out. So you'll begin either on the left or right side, either one, but you want to pull the lung lobes like that and then cut the entire root at once. So you want to leave the lobes together and pull them out as one piece. And you also want to be really careful, there's a bunch of nerves down in here that you don't want to cut. So you're very carefully going to cut through that and pull out the lung. So this is the left side, it's the left lung. And the left lung has the cranial lobe and the caudal lobe. Then you also have, in the cranial lobe, you have a cranial part and a caudal part. Then on the caudal lobe, on the left side, you have the aortic impression, right here, and that's where it was resting against the descending aorta. And then also on this specimen, you can see a little piece of that pulmonary ligament here that we identified previously, so maybe you'll be able to get a better view of that. Okay, then we'll move to the right side, where you will do the same thing with your right lung. However, on the right side, you'll have an accessory lobe, and that is going to, put it back kind of how it is. It wraps around the caudal vena cava here where my finger is, and you actually have to push it out and through around there. You can see where it kind of goes around here. So that's the accessory lobe. So you need to push that out and then pull your lobes away and cut them very carefully, again, avoiding those nerves. And so on the right side, we have cranial lobe, the middle lobe, caudal lobe, and the accessory lobe here. Then also on the right side, you want to note the cardiac notch. So when the lungs are inside the chest, it has this little notch around the heart here. So it's kind of between the cranial lobe and the middle lobe, but also extends up through that cranial lobe here. So that whole part is the cardiac notch. So then you'll take out your lungs completely, and then you will want to try to see the trachea coming down and where it bifurcates. So I'm going to try and get the probe down in there. So here's your trachea coming down here, and it splits into the left and right principal or primary bronchi. So here would be the right, and on the other side would be the left, and right here where the probe is that bifurcation called the carina, where the two split. So you want to look for that, and then also look for these tracheobronchial lymph nodes, which there's one right here sitting in the carina, which is often the case, or you may have some on the lungs you pulled out, or they may be kind of around in this area. Then you want to look at your lungs, your isolated lungs, and note the lobar bronchi. So here on the right side, you'll have 4 lobar bronchi for the 4 lobes. So here would be the cranial lobar bronchus, and here would be a middle lobar bronchus. Here would be a caudal lobar bronchus, and then an accessory lobar bronchus. So basically the lobar bronchi just go to the different lobes. So you'll want to note that, and then bag your lungs separately and save them for later study. All right, moving on into the chest, we're going to look at some of the great vessels. So here's the heart, here's the phrenic nerve running down alongside the heart, and we're looking today at the cranial vena cava, which is right here, and also the azygos vein running down towards the back, which we'll come back to that in just a second, but that's the azygos. Here's cranial vena cava. Then cranial vena cava, moving toward the head, will have 2 branches contributing to it that are called the brachiocephalic veins. So here you have a left brachiocephalic vein. Here's the right brachiocephalic vein. Those coming together then go into the cranial vena cava. So following the brachiocephalic vein towards the head, you will have it split. So here I've cut the subclavian away so I could look at the arteries underneath, but this is the subclavian, so right subclavian vein, and attached right here where the forceps are. And then this is the external jugular vein going up. So external jugular vein, right subclavian vein, those two join and form the brachiocephalic vein. Then you have left and right brachiocephalic veins join to form the cranial vena cava. All right, then we'll move down by that azygos vein that I mentioned just a little bit ago. So the azygos vein going down here, and then you'll want to dig just ventral to that in this tissue very carefully, and hopefully you'll see a thoracic duct, which is this tannish brown structure here. It looks like a little tube, almost like a little worm, but this is the thoracic duct. It has lymph inside of it, so you want to look for that. Sometimes you'll find them, sometimes you won't. And then on this dog, if you look at we'll go on the left side, and by the carotid, in the carotid sheath, you can look for a tracheal duct, which is sometimes very difficult to find because they're kind of blend in. Here, if I can get the probe underneath it, there we go. This is a tracheal duct. So your carotid artery is right down here. So running alongside that, you hopefully will have some remnant of a tracheal duct, and you'll see it running down there. If they're nice and filled, it's easier to find. If they don't have anything in them, it's a little more difficult. So there's the tracheal duct. Then we'll move on to the aorta. So here's the heart. And here we have the aorta coming out, so that will be the ascending aorta. And then this arch, this curve, is the aortic arch. And then you will have the descending aorta coming down here. So ascending, aortic arch, descending aorta. Then on the descending part, you'll note these dorsal intercostal arteries all along here. And then we'll move back up towards the arch and identify the brachiocephalic trunk, which is right there. So that's the bigger one. The first branch coming off of that arch is the brachiocephalic trunk. And then that will branch into 3 separate pieces, which you can see here. So here you will have the left common carotid artery. Then you will have the right common carotid artery. And then you'll have the right subclavian artery, all coming off of brachiocephalic trunk. So again, left common carotid artery, right common carotid artery, right subclavian artery. Then we'll move to the left subclavian artery, which is that second part coming off of the arch here. So left subclavian artery. And we'll follow that and look for 4 different branches coming off of that. So left subclavian here, and you'll look for costocervical artery, which tends to branch right away. It's one of the tricks I use to find which one is costocervical. So right here, going to the first few ribs. Then you will have a vertebral, which comes off sometimes almost at the same point as costocervical, but dives deeper. So that's going down towards the back here. So vertebral artery. And you have internal thoracic artery going towards the sternum, right here. And then you will have superficial cervical artery coming off and going up by those superficial cervical lymph nodes we saw before. And then this will become the axillary artery when it rounds the rib cage and goes out of the thorax. So that would be axillary. So again, we'll just do those really quick. So you have left subclavian, costocervical that branches right away, vertebral artery diving deep, superficial cervical artery, and internal thoracic artery. You'll have the same branches on the right subclavian as well if you want to find them over there. And if you do, you can feel free to cut veins. Just leave a stump to make sure you can identify it, but you can cut the veins and move them out of the way. All right, a couple of little things that we want to make sure and mention are here on this side. The left side is the phrenic nerve here, running down. And then also, if you can find a bronchoesophageal artery, may not be able to see it very well from this side. Sometimes I look on the other side. It should be coming off of one of your dorsal intercostal arteries. So I'm going to turn the dog just a little bit here. And hopefully we can get a glimpse of one of those. So looks like this one is going on the esophagus here, so that could be a bronchoesophageal artery. They are very tiny and hard to find, so if you find something that looks like it might be going there, it would be bronchoesophageal. And I believe that's it on lab 11.